Hi, and welcome to another episode of the OK Guard Show. My name is Staff Sergeant Brian Schroeder.
And I'm Leanna Maschino, and today's episode is over Tricare, primarily Tricare Reserve Select for you Guardsmen.
Yeah, come to find out, there's a very, very small percentage of Guardsmen who actually take advantage of the Tricare benefits that are there for us. Whether you're an in-day soldier, you're an AGR, FedTech's a little different, but we talk about it in the podcast. But it is an excellent way for you and your family to be covered at a very, very low cost.
Low cost and excellent coverage. So a lot of Guardsmen don't realize that they have those benefits because they are part-time. You do have to pay for it, but it is a very low cost, like Brian said. And anyway, enjoy the podcast. If you have questions, make sure you shoot us a message or comment, and we'll get those answered for you. Ready to go?
Let's go.
Let's do it.
Learn about some Tricare.
So let's start out. Introduce yourself, first name, last name, what your position is, and we'll go from there.
My name is Darrell Toquinto. I work for Humana Military. I've been working with the Tricare for National Guard and Reserves for going on 5 years, be 5 years this June.
Okay.
I am a Tricare educational briefing.
Mm-hmm.
I just brief National Guard and Reserves on their Tricare benefits. I do family days. I go to family days, yellow ribbon events, demob, pre-mobs, and regular annual briefings for Tricare.
So you talk to family members and things as well, other than just Guardsmen?
I talk to a lot of family members, and it's really important to talk to the family members because sometimes, the family members aren't there during our annual briefing, and so family members seems like they have the most questions.
Okay.
And it's really good to get this out to them so that they know and have the resources at their fingertips, because that's what it's all about nowadays, is resources at your fingertips.
Right. Broadly discuss what Tricare offers.
Tricare, it's a uniformed services health care program which brings together the health care resources of the military health system, such as military hospitals and clinics. And so it's about network and non-network, and that's very important to know because there are Tricare networks and non-network doctors to go to, and then there are non-networks that don't accept Tricare.
Okay.
And education is the key. I mean, this is what this is for, to educate, and that's what I tell sponsors and beneficiaries all the time. You have to educate yourself. Don't just assume that what you're getting in this briefing is all you ever need to know. Tricare.mil. That's the main website to go to and utilize if anyone ever has any questions about Tricare.
So are they able to contact you directly if they have questions, or do you recommend that they go to the website or call the main Tricare?
I enjoy answering questions. Sometimes the questions can be really in-depth.
Okay.
And for those in-depth questions, we can always talk at a later date in the email or on the phone, or we can definitely refer them to the Humana Military phone line.
Okay, great. What all does it cover? Dental, vision, health, everything?
Tricare is health.
Okay.
We have Tricare Reserve Select for health insurance. We also have a Tricare dental plan. That is ran through United Concordia. Vision is we only offer one eye exam per year per family member for vision under Tricare.
Okay.
But under the new FedVet, well, it's not new, but FedVet program offers vision health insurance for National Guardsmen.
Okay. Now let's, we're saying Tricare, but for Guardsmen, they are, unless you are on active duty orders, correct? You're, which is a Tricare either Prime or Standard. But
okay. Well, let's talk about that, because Tricare Reserve Select is for non-active duty members and their family. Okay. Tricare Select or Tricare Prime is for active duty family members and the service member.
Okay. And I guess what is the difference between active duty Tricare benefits versus Guard Tricare benefits?
Well, Tricare Reserve Select for non-active duty, you have a monthly premium.
Okay.
And so, and of course you have to enroll. You have to enroll into that. And the monthly premium for an individual is $42.83 a month.
Wow.
For just a member only, just for themselves. And member and family, whether it's a a member and a child, or a member and a spouse, or a member and one child, or a member and 10 children, it's $218 and a penny a month.
Okay.
And that's very affordable. Now, the main difference between non-active duty status and when they go active duty is the monthly premium is no longer. They don't pay that monthly premium anymore.
That's embedded in part of their active duty service.
Yes.
Okay.
Yeah.
Okay.
Because, and we may talk about this later, but there's, depending on what their orders say and how they're cut and everything, they may be eligible for up to 180 days of early eligibility. And the key word to focus on that is up to 180 days, because a lot of guardsmen will think, oh no, I have 180 days. No, it states up to.
Okay.
So they may have 3 months, or they may have 4 months, or they may have 4 weeks.
Right.
And, their families, the sponsor and the beneficiaries, they get Tricare. But you have to keep DEERS up to date for your family members to be eligible for that.
Right. What or who determines the length in which you have that coverage? If it's up to 180 days.
The units themselves,
Okay.
They are in charge of the verbiage in the orders themselves.
Okay.
Because it has to be in support of a contingency operation of 30 days consecutive or more.
Okay.
So there's certain verbiage in the orders that determines that.
Okay.
Normally, their unit should let them know ahead of time.
Yeah,
Hey,
okay.
this is what we're doing. We're cutting orders, and then the unit is supposed to notify the service member if they're going to be eligible for early
Okay.
eligibility. Does that happen? Well, maybe not. But that's where DEERS comes into play, the Defense Enrollment Eligibility Reporting System. As long as the sponsor keeps their DEERS up to date with their email, their phone number, and address. And email is really important, because once DEERS receives those orders, they will email the sponsor what them or their family is eligible for
Okay.
Tricare.
Is there any way in the system that, because sometimes for a guardsman, checking their .mil account is a pain.
Well,
Yeah.
they can sign up for email alerts through Tricare.
Okay.
But ultimately, DEERS, they review that for eligibility status to Tricare.
Okay.
Because I'm not in the National Guard or Reserves, but if I was to call Tricare right now and ask them if I'm eligible, 9 times out of 10, they'd probably say yes.
Okay.
But once I go into the DEERS system and try to put my information in, that's going to determine my eligibility. One, because I'm not a guardsman.
Right.
So being National Guard or Reserves, that's the eligibility status, unless you're a federal employee.
Right.
That's the one
Yeah.
thing that I get a lot of questions
Yeah.
about is the federal employees.
That's something I definitely want to touch on, and we can go ahead. Right now, TRS, or Tricare Reserve Select, is for guardsmen who are not an active duty service member and are also not a federal employee. I'm a federal employee, so I know as a federal employee and as a guardsman, I'm not eligible for Tricare. But there are rumors, and you don't have to speak on this if you don't know, but that could potentially change for federal employees if they are a dual status guardsman. Is that?
We all have heard the rumors. I won't speak on those rumors,
Sure.
but the rumors are out there. And all I can say is maybe one day that will possibly change
Okay.
for everyone. I mean, that's...
Which would be great. It's for like Major Legler. He's in his uniform today. He's Title 32 dual status,
Right.
but he can't have Tricare unless he's on active order. Or Brian right there, who's pointing at himself, and he's got a frumpy face. If I could turn a camera on him, I would.
Well,
But there's a significant difference in cost, and I know we're going to talk a little bit about cost. But
and if I may, if we could just talk about federal employees just briefly, especially if you're a new soldier coming in and you're considering going to federal employment or have a federal position and you have Tricare, just remember you must accept federal employment health benefits. You do not want to try to attempt to keep Tricare and not have your federal, because that could may cause issues later on. So if they get offered federal please take it.
Okay. If someone is in that same position, should they contact Tricare and let them know, I have just become a federal employee and therefore I've enrolled in federal benefits, I need to cancel Tricare, or does FEHB and Tricare communicate with each other? And how does that work?
Definitely call Tricare, but you always want to make sure DEERS is up to date with that information as well.
Okay.
Because there again, DEERS
With your
provides,
FEHB?
yes,
Okay.
because DEERS provides that eligibility status to Tricare.
Okay.
So even if you just forget to call Tricare, Tricare will find out.
Whoever's listening, when I say Tricare, because we're talking specifically Guard, I mean Tricare Reserve Select. So I just
Yes.
want to make that clear. And we'll touch on active stuff a little bit later. But as far as receiving those benefits, what are the requirements? Is it as soon as you go to MEPS and you swear in and all that, or how does that work?
You know, as soon as you sign that dotted line and you commit, you're eligible unless you are a federal employee or technician status.
So you're saying basically once you swear in, you are then eligible for Tricare because you are a member at that
because then you're going to
point.
start going to drills. You're going to start going to drill status. Even that paycheck, that's a good thing because there may be ING, I think you call it, inactive guard status. If you decide to go inactive guard status for any period of time, if you had Tricare Reserve Select before going inactive status, you will not have it while you go inactive status because you're not receiving a paycheck.
Right.
But then as soon as you come back from inactive status, then you can go back into Tricare Reserve Select.
Okay. Do the benefits change? And if so, how often? Is it something that Guardsmen should check online, check their is it a 6-month coverage plan, and then maybe in 6 months that will swap over to something? You know.
Well, no, it's a monthly premium.
Okay.
The monthly premiums will stay the same. Now those might change on January 1st of every year. It used to be a fiscal year. Now it's a calendar year for that. If the internal components of Tricare Reserve Select changes itself, they can get those email alerts through Tricare.mail. They can sign up and get those email updates.
Okay.
And I'll be real honest with you. In the past, I've gotten questions about certain things that they've gotten the email alert updates before I've even gotten the information. So it's possible.
Okay.
You know.
And how significant would those changes be? Because one of them I know was Tricare swapped from using another dental insurance to United Concordia, correct?
Yes, that happened last year.
Okay.
So, and that's definitely a big because, you know, for whatever contractual reasons, you know, United Concordia came back to manage the program.
Okay.
So that's a good email alert that they would have gotten.
Something like that, it could be that your actual coverage does change.
Yes.
To include
Yes.
providers who accept that?
Providers.
Okay.
I mean, that's the really good thing is because just because one provider accepted your old insurance, and let's call that OHI for other health insurance. If one provider accepted your other health insurance and now you have Tricare, don't just assume they are going to accept Tricare. You have to ask them.
Yeah.
And if they don't, you know, you can always ask them to, hey, would you like to come join the Humana military family and be a network provider? If not, then they would need to find a provider.
Okay. And I would say ask if they are in network, because I've
Definitely.
asked, do you accept Tricare? Yes, and then they were not in network.
Definitely
and so
ask if
I had
they
to
are.
bill. That was a bummer.
Yes.
So yeah, that was a lesson learned for me. But it was just because you're talking about being educated and not knowing.
Right.
I mean,
and that's another thing about asking, or even if you're utilizing the website and looking for a network provider, if you find a network provider on the website, don't just assume that they have an opening.
Yeah.
Call them, verify, do you have an opening? Because they may say, no, we're full.
Okay.
Go to the next one on the list.
Okay.
And I tell beneficiaries and sponsors this all the time. If you run into where you don't have your list is exhausted, call Tricare. We can help you.
Perfect.
And that's what we're there for.
What about the emergency room? How does that work? If something happens to your child, to yourself, to your spouse, whoever is a beneficiary or sponsor.
Emergencies are considered life, limb, or sight.
Okay.
Okay. That's if you visit an emergency room, we really would like if they could call Tricare within 24 to 48 hours of visiting that emergency room.
Okay.
Okay. For billing reasons, or if that emergency room is not in the network, I mean, it doesn't matter. We just really, that way Tricare can be informed and help you out with that as much as possible.
Is that just calling them saying, hey, this accident happened, I had to come to the emergency room?
Right. That way it's like being proactive.
Yeah.
You're being proactive with your health insurance.
Okay. An emergency situation, I know family members may probably not think about it at the time because they have something much more important, especially if it's their child or something that they need to go to the ER. But if that particular hospital that's closest to them, if they think, actually I know this hospital's not in network, so we need to drive 30 minutes, but I'm not going to do that is there?
Okay, and if there's a hospital right around the corner from you and you know for sure that they don't accept or they're not in Tricare network, or even if they do, if it's right around the corner from you and you've experienced a life, limb, or sight, just go to the closest one to you. There's no sense in prolonging your pain or sickness or whatnot.
Okay.
I mean, especially, families with young children, you have to make the best decision possible that's good for you and your family. One thing I'd like to give is the phone number to our nurse line for Tricare.
Perfect, yeah.
1-800-TRICARE.
Oh, easy. Can you spell Tricare for us? Just kidding.
And what you call that, and you're going to speak to a nurse.
Okay.
And he or she will listen, and they will advise on what you can do. Especially if you've got a young one that's just been crying and you're not sure what, you can.
Right.
They may say make an appointment with your PCM, and they will put that into the system right there.
Okay.
Now, if they say go ahead and go to the ER, they're going to put that also in the system. So that number is there to help them. I mean, I've raised 3 girls. I know what inside of an ER room looks like, and so it's not any fun.
Yeah. You would more so, I think, if you had boys.
Yeah.
I've heard they're a little rougher.
Well,
are they?
Well,
Did Matthias get hurt?
As a boy growing up with me, if I got hurt, you just had to suck it up.
Yeah. There's some dirt on it. That's what my granddad said. You talked about PCM, which is what triggered
Primary care manager.
Right. And that reminded me of the previous question. One thing I think about Tricare, some people think is, Tricare, I have to go to Tinker and get a referral and blah, blah, blah. That is for an active duty or an AGR type position, right?
Well,
Tricare Reserve Select, you can choose your own if it's in network?
Yes.
Okay, no referrals necessary?
Well, I wouldn't say no referrals.
Okay.
There are some cases that you will need a referral from your primary care manager.
Okay.
Just to be advised of that. But as far as going to utilize the military treatment facility or a military hospital, active duty, when they go on active duty, for sure, and Tricare Prime for their family members, they can utilize that as well.
Okay.
But Tricare Reserve Select allows you the freedom to choose your provider.
Okay. Your primary care and your dentist and...
Tricare Dental program allows you just as long as it's a network, choose your provider. Yeah.
Okay. And process of that, you just call and make an appointment and say, I have Tricare Reserve Select. Are you in network?
They'll schedule an appointment and you go in. Your military ID card is your insurance card.
Okay.
Because on the front there's like I think a 10-digit number, and on the back there's like a 11-digit number. I can't remember specifically, but but they can use that.
Okay. What about family members? If they have to have a...
I think there's a certain age limit.
Okay.
I don't remember.
And they have to have the, what is it, the
dependent
ID? Okay.
card. Yeah.
So,
now the spouses will have their own ID card as well.
Hello, listening and viewing audience. Just a quick public announcement. The 2019 Best Warrior competition will be held at Camp Gruber, USA from July 15th to July 19th. Our hardworking team at the OK Guard Show will be there providing coverage of your favorite Best Warrior competitor from across the country. Tune in throughout the week to hear interviews from actual Best Warrior competitors in the field, words of wisdom from Sergeants Major judging the competition, and tips and tricks for all you potential best warriors to think about for future competitions. And now back to your regularly scheduled podcast.
So we talked about cost, and I know this question is phrased as, on average, how much can a guardsman save, which, if they use Tricare, which of course depends on, there's all kinds of health plans out there, but in your experience in the classes that you have taught and the feedback you've gotten, I mean, what kind of feedback have you gotten for Tricare users versus them using another healthcare provider?
The feedback I've received, the savings can really be beneficial to them as a family. I mean, the cost, you have to weigh out more than just what you're paying in the monthly premium, because you have to look at what your deductibles are, what's your catastrophic caps. I mean, these are numbers that are all important. So having a low monthly premium and a low catastrophic cap and a low deductible is really beneficial to have for Tricare Reserve Select users. Some have saved maybe up to 100. Some may have saved more. It just really all depends on where they're at and what they're doing.
Okay. My personal experience, Tricare was incredibly affordable and the coverage was amazing. And I've heard nothing bad really about it.
And I like personal experience stories, and even suggestions. If I'm giving a briefing, if someone's got a personal life story that this is what's pertaining to what I'm talking, I'll listen, because that's helping me,
Right.
and that's also helping everybody else in the audience, because someone else may have had that same exact question to help them. So saving money is a bonus, especially in today's economy. We need every penny we can get.
How often do you see guardsmen not taking advantage of this benefit?
All the time. I mean, I really love what I do. I'm passionate with what I do, and so when I hear someone, "Oh, I don't have Tricare. I don't want it," or I'm like, "Why? Please, why?"
Yeah.
You know, one of the things that I think kind of touched me the most, one time I was doing a retirement briefing here at the Joint Forces Headquarters. And I get done speaking mainly to the retirees, a little bit to the individuals who are just getting out just because. And I go out, and this young lady, E4, comes up to me, and she's like, "So I'm eligible for Tricare?" I'm like, "Yes. How much longer do you have left?" She goes, "I have 3 weeks." I'm like, "Okay." She goes, "Can I get it?" I'm like, "Probably not."
Yeah.
She goes, "When would I get it if I was eligible?" "From the day you joined." She goes, "I never knew."
Yeah.
I'm like, "Oh." And I'm sure there's other stories out there about that, but those are just, I think those hurt the worst, because my goal is to educate, and I want to try and reach everyone in the Guard and or Reserves to let them know that, I mean, Tricare's there. For those of you who are going to be having a newborn, it's very important that after your baby is born, you need to get the birth certificate, Social Security card, and get your newborn enrolled into DEERS within that 90-day period. Because your newborn is automatically covered under Tricare Prime if you have Tricare, but you have a time period to enroll your child. So don't just assume just because your newborn is in Prime and you have Tricare Reserve Select that your newborn would automatically enroll into Tricare Reserve Select. No, you will need to manually go ahead and enroll your newborn into Tricare Reserve Select.
Do they have to enroll themselves every year?
No, it's once they enroll once, I mean, as long as they're paying that monthly premium, they're really good to go.
Okay.
Unless, they come down on active duty orders and they're on deployment and they have TAMP, the Transitional Assistance Management Program.
Okay.
That's when things get a little bit misunderstood sometimes.
Okay, perfect. So can a service member keep their Tricare benefits after they get out of the military?
There's a program, it's called Continuous Healthcare Benefit Program. It's for individuals who are just getting out of the Guard or Reserves just because, and they want to be able to continue health insurance. It's not a Tricare program, but it's called Continued Healthcare Benefit Plan.
Is that what retirees get?
No, that's that's a whole different ball of wax there.
Let's say traditional guardsmen all the way through hit their 20, they're done, they retire. They've had Tricare this entire time. Now they're retired, no longer in the Guard. How does that work?
Well, and might be a little misconception. Even if you had Tricare Reserve Select the whole time you were in the Guard and you hit retirement status, or even if you never had Tricare Reserve Select the whole time you were in and you hit retirement status with your 20-year letter, you can still, once you retire, the exit date on your orders, that's when your Tricare Reserve Select ends.
Okay.
And that's when you're eligible to pick up Tricare Retired Reserve.
Okay.
Now that, some Guardsmen will retire at 38 or 40, and so they've got a whole nother 20 years to go before they can make another retirement out of something. So and that's the gray area of retirement. Okay, if you retire at 40, from 40 to 60, that's the gray area of retirement. You're no longer eligible for TRS, but you're eligible for TRR.
Okay.
And the monthly premiums do go up, of course. But that's where I tell retirees, you have to know what is out there.
Yeah.
You do a side-by-side comparison with Tricare and 2 or 3 other companies, or sit down and talk to your HR rep and say, what does your health insurance offer? Who do you go through? I mean, you have to educate yourself.
Is there a time frame to enroll in that? And I say that as in, we have a lot of retirees that may swap over to be a federal employee as a civilian and finish out and get pretty much a dual retirement out of that.
The goal is because we want to try and eliminate any gaps in coverage with health insurance. And so if they have Tricare Reserve Select and they want Tricare Retired Reserve when they get out, at least 90 days before they exit.
Can they have, because they've gone through they've hit their 20 in the Guard and they've done their time, and then they become a federal employee, are they then not eligible for the Tricare retirees?
Tricare Retired Reserve, if they're a federal employee in their gray area status, they're still not eligible for that Tricare.
Once they retire as a federal, can they get Tricare at that point?
Are we still talking about in between the gray area?
Yes. So let's say
yes.
they retire from being a federal employee at 62.
They can if they want.
Okay.
And look at the cost.
Yep. Okay.
That's very, very important. Now, if they transition from federal status and they want Tricare Retired Reserve in the gray area, they will definitely need to probably call DEERS or go to the closest ID card facility and verify their eligibility in this system. Because once they leave their federal, sometimes it may take a little bit from stories being told of systems being updated showing eligibility status from no longer being a federal employee.
Okay, gotcha. In the Guard, some people think we're just weekend warriors. I hate to say that, but some people say that and think that. And a lot of people don't know that we actually deploy quite often. I just got back from one in Afghanistan 6 months ago. So you're a Guardsman and you have Tricare Reserve Select, and all of a sudden you get a notification that you are going to be deployed.
Okay.
Walk me through that. How does the coverage for them or for the sponsor or the beneficiary change being on active duty, and then what happens when they come back?
Once they get that notification that they're getting those orders, now they're waiting for that official notification from DEERS stating what them and their family members are eligible for. So if they had Tricare Reserve Select before, it's a premium-based health insurance plan. Once they are eligible for that early eligibility status of up to 180 days, there's no longer that monthly premium. Okay. Under Tricare Select, because the families can have Tricare Select and or Tricare Prime or B Prime Remote. But Tricare Select, they have the deductible or copay and deductible and catastrophic cap, whereas Tricare Prime, they don't have that deductible, but they still have the catastrophic cap.
Okay.
So under Tricare Prime, Tricare picks the provider for them.
Okay.
And that's where Tricare Select is more, you get to maneuver through the network system, where Prime, they pretty much they select that.
Okay.
The sponsors, the ones who wear the uniform, are normally Tricare Prime, and they usually get their care in a military treatment facility or approved clinic.
So while that service member is deployed, and let's say they have a wife and some kiddos at home, they're in a remote area, it's not very easy to talk back and forth. If can the spouse or family member back home manage that at all? Are they able to call Tricare if they have specific questions, if they have to be referred, or?
That's a really good question, and you know, it's I think before it used to be power of attorneys were the way to go to allow your spouse to have that health insurance to speak on their behalf. You know, HIPAA, I think it's HIPAA.
PAA, I think.
Yeah.
Yeah.
That's basically what it's Information Security Act. If their spouse is not on that form, then Tricare may not talk with them about their benefits.
Yeah.
And so that form is also available on tricare.mil.
Okay.
They can go in, they can fill it out, they can send it to Tricare. That way they know for sure that their family members can speak on their behalf, because if they're 1,200, 2,000 miles away,
Yeah.
they're deployed, their mind is going to be where they're at.
Right.
And it's so if they're come up with a problem, and I've been deployed, I know. So if they come up with a problem with the family, now their mind is diverted from where it needs to be
Yes.
back home.
Yes.
And so that's what we try to help eliminate is some of that stress. So having that HIPAA form and get it signed and sent back in is very important.
Okay.
And they could call Tricare, they can call DEERS if they had a question.
So when we deploy, we have family readiness support, what FRISAs, assistance, family readiness support assistance. Are the family members able to talk? Do you guys communicate with those family programs people who are there specifically for deployed soldiers?
I some of my point of contacts are FRISAs.
Okay.
And I mean, great people. I mean, because they're welcoming. I mean, they appreciate all the information we can give them about Tricare. And if their spouse is deployed overseas somewhere, and they feel like, okay, I've got a group of spouses here that needs a briefing on Tricare, maybe, and I can, if they put in the request, I can be there.
Okay.
Yeah.
Okay. Is there a minimum number that you'll come
Not
and bring
really.
to?
No.
Okay.
I mean, it could be 5 or it could be 500.
Okay.
I mean, because even if there's 5, there may have been 5 more that wanted to come.
Right.
So that 5 can help the next 5. I mean,
Yeah.
that's what it's all about.
Absolutely. Okay. So when they come back from a deployment, I was put on TAMP.
Yes, Transitional Assistance Management Program.
Okay, well, let's
it's
talk about-
180 days of continued Tricare.
Okay.
Okay, so normally the TAMP will start either A, when their active duty orders end, or B, if they take leave and their leave ends. And that's when the 180 days start.
Okay.
Now, the family will remain on Tricare, Tricare Select or Tricare Prime during that time frame.
Okay.
The beneficiary, the sponsor, will stay Prime.
And at the end of that 180 days, they need to re-enroll in
Yes.
Tricare Reserve Select?
Yes, at least 60 days before their TAMP ends, they
Okay.
must re-enroll back into Tricare Reserve Select, and that means when you enroll initially, you're paying too much premium up front.
Right, okay.
So that's what you're doing all over again.
What happens if they just forget and it's a week before their TAMP ends and they need to re-enroll?
Well, the best thing to do is just go ahead, and they can do BWE by web-based enrollment, or they can call Humana Military now
Okay.
and do phone enrollments.
Cool.
So if they forget and they're in a short time frame, maybe they should go ahead and make that phone call and try to get that enrollment going, so that at least they can try to work with the start date.
How long does it take once you enroll to once it's active?
The processing of enrollment is relatively fast,
Okay.
to my knowledge. And plus, I guess it all depends on if you enroll in the middle of the month or towards the end. I mean, it just really all depends. If you want to enroll online, and you put in all your payment information. At the very end, it'll give you a date, and that'll be your start date.
Okay.
So it just all depends.
Yeah. Okay. So let's talk about how to enroll. Walk us through. You talked about. It's great. There's phone and web-based.
Yes.
Is there in person also?
No.
No.
Not
Okay.
anymore.
Okay.
Web-based is with your CAC card. Don't know what the CAC stands for. I have
Common
one.
Access
There
Card.
you go. Thank you. You can enroll with your CAC card, and I was privileged to kind of stand off to the side and kind of see someone enroll through this process. I wasn't looking over his shoulder or anything, but I mean, he went through it fairly quickly, and it maybe 15 minutes, and he was done. And I'm
Nice.
like, wow, that's amazing. Or you can call Humana Military.
Okay.
Well, you can get to it a couple of different ways.
Okay.
If you start out in the Tricare.mil website, there's information box at the top. You can hover over, and there's a hyperlink there you can click on how to enroll.
Okay.
And initially, it will take you to where you need to go to enroll. I think in the end, you're going to end up at the DMDC, Delta Mike, Delta Charlie, the website, and that's where you're going to do your enrollment at.
Okay. And then if they do the phone,
I haven't been privileged to sit
Yeah.
by and see how that goes. I've heard it's been pretty good.
Okay.
But you just sit there and you just provide them all your information. Now, one thing I will let you, and I think it was probably one of your questions, but the beneficiary, the sponsor, the one who wears the uniform,
Yep.
that's the one who needs to do the enrollment.
Okay.
Spouses are not allowed to. It
Okay.
has to be the one wearing the uniform.
So we covered how to enroll online. You can do it by phone. Sometimes if you're doing it online, if there's confusion, I assume you can call someone to, hey, I'm trying to enroll online. Can you walk me through this? Is that you, or is it someone at the 1-800 Tricare?
It's someone at the Tricare office.
Okay.
Yes. I am not included or involved in that role of
Okay.
of enrollment. When I go to and do briefings, I'm there to educate. I'm
Okay.
not there to take any money or do any enrollments.
Okay.
And just know that when you do enroll, you're paying 2 months premium up front. So the $42.83 times 2 if you're a member only, or the $218 and a penny times 2 when
Okay.
you enroll.
Do you have to, and it's all up front. They won't allow you to.
No, it has to be when you do the enrollment process. It has to be taken out of a debit card, credit card, or EFT.
What's EFT?
Electronic funds transfer through your bank.
Okay.
Tricare Reserve Select monthly premiums cannot be taken out of your drill pay, and
Okay.
I always repeat that twice at my briefings. They can't be taken out of your drill pay. The Tricare Dental program can be taken out of your drill pay, but the
Interesting.
Tricare Reserve Select Health cannot.
Okay.
You were at E1 once, right?
No.
E2?
I came in as an E4.
Okay,
so.
well,
Just kidding.
E1s, E2s, E3s,
Yeah.
and possibly E4s may not make enough on drill status to cover a family monthly premium.
Right.
So that
Right.
we don't want to create any kind of debt for them. We want to make it as easy as possible.
Okay.
And this goes along with enrollment. If you use a debit card or a credit card, and for whatever reason, from the time you submitted that information to Tricare, and you needed 3 tires on your car, and now you just spent money on tires.
Yep.
Well, if Tricare attempts to secure those funds, and those funds aren't there, then you won't have Tricare, and they won't wait till next month. You
Right.
will have to resubmit your application all over again.
Whew, okay.
Yeah.
We talked about resources, but let's go ahead and list them out again and again in our show notes. I'll write those down for people who can click links or call numbers and who to talk to and things like that. So what are some resources that Guardsmen and their families can use to find out more information?
Tricare.mil.
Okay.
That's my go-to website at every briefing. If I'm briefing for 20 minutes, I may let them know about 5 different times. If you get anything out of this briefing, always remember Tricare.mil. And Oklahoma, if you live outside of the Oklahoma, like say Kansas or towards the west, you're going to be in a different region. It's going to be a Tricare West region. We are in a Tricare East region. So Tricare East region is Humana Military. It's 1-800-444-5445.
Okay.
You know, if you're married or if you have a family, sit down and discuss with them about your health insurance. I mean, it's a topic that probably many people don't like to talk about, but you have to. You never know what can come around the corner if you don't have health insurance. Tricare Reserve Select, Tricare as a whole, I mean, we are there. We want to make this process as easy as possible for the sponsors and their families. So educate yourself. That's the key. You have to educate yourself.
Thank you, everyone, for tuning in to this month's episode on Tricare. Next month, we have a pretty juicy, fun topic that's very important.
Yeah, that's true. You might say we will break the bank with this one. It's about money. We're talking about money, and money matters. And all you that are M-Day soldiers and you really don't want a part-time job at Target or the snow cone stand again this summer, should really figure out how to pinch those pennies that you already have. And our discussion next month will definitely help clear up some of those things and show people different options on what to do with your money. Explain some of those things like an IRA or savings account. What does that mean? I don't know.
We can dabble into how credit cards work. How you have to be smart if you have one. We'll dive into TSP, which is offered for Guardsmen. So it'll be a really good episode for you guys to tune in. So we look forward to seeing you next time.
Yeah, be sure to like us on Facebook, reshare our tweets on Twitter, and check us out on YouTube if you want to see a video representation of this audio podcast.
Get to see us yapping to people.
Like you.
Yeah. All right.
Thanks.
The OK Guard Show is produced by the Oklahoma National Guard Public Affairs Office. Any mention of products or brands does not imply endorsement. All guests on the show are volunteers in an effort to inform and educate members of the Oklahoma National Guard, their families, retirees, potential recruits, and the community.